When I was young, I always knew that I wanted to get into healthcare. I had my own doctor set and I would practice on my little cats in Sri Lanka. My role model was my mom. She was always giving back to the community. She always encouraged me to think outside of my comfort zone and to serve others.
My faith is a big part of my life. It's kind of the crux of who I am.
My name is Shannon Fernando, and I'm a family nurse practitioner at the Los Angeles Christian Health Centers and the Midnight Mission Satellite Clinic on Skid Row.
My plan was to go to medical school and be a medical doctor.
But I didn't get in when I applied, so I decided that I needed to rethink how I was going to enter the healthcare field. I went on a mission trip to Kenya, and it was there where I really felt like there was a calling for me to go into nursing. A nurse practitioner is an advanced practice RN. We can write prescriptions and see patients as their primary care provider. I started volunteering with an AMericorps organization, and they placed me in the Skid Row area. It was during that time that I realized that I wanted to devote my healthcare career to this community.
I feel like the poverty that I see on Skid Row is really a poverty of the spirit, a poverty of social connections, of self-worth. To find people and agencies that really care and can walk alongside you even when you fail and to help you get back up, to give you second chances, that's what the people that I serve here in LA really need.
We see people struggling with drug use, we see people with mental illness, and we see people who don't have housing, are homeless. George came in because he was having significant difficulty breathing and pain in his chest.
I was suffering from heart failure, and she had me rushed to the hospital, and it saved my life.
He felt like he was given a second chance from God, and he wanted to get housing and get sober and change his life.
I was homeless. Through her and her agency's help, I'm now off the street.
He's now been sober ever since, and he's now housed, and he's doing so much better. Housing and healthcare go hand in hand. We create a lot of access for patients to come in and to be seen by a medical provider. Because of that, there's consistency in care. So they get to see the same provider, and we build rapport with them, and there's trust. I care for them in a way that I know God cares for me, and so that's what gives me the strength to do what I do and keeps me here. Medicine is such a unique profession because we get to be in a patient's life at a really vulnerable time. To be a part of that and to walk alongside them in that is the greatest honor. So I actually had the privilege of being here and working with LACHC when the Affordable Care Act passed. And so I saw a lot of my patients be able to have access to the care they needed. With the Affordable Care Act, there's always going to be a need for health professionals, especially in the underserved communities.
The great thing about working in primary care is it gives me a lot of time to have a life outside of work. I work my set hours and I come home and I have a lot of personal time. My husband Ashanta does most of the cooking, actually all of the cooking. We walk our dog, we go to church, we go visit my parents, we hang out with our friends, it's great.
When I found out about HPEF, obviously really excited. The loan repayment program has allowed me to pay off my student loans. That's really sustained my work with LACHC. I don't know if I'd been able to work here for this long. It gives us longevity in the areas we're serving in. What I'm doing right now is what I was created to do. And so I have that sense of fulfillment every time I'm here, whether it's a hard day or a good day.
All of my passion really comes from my faith in God. And so the more I work in this community, the more that grows in me.
I definitely love what I do.
The Health Professions Education Foundation is a nonprofit within the Office of Statewide Health Planning and Development. To make a donation or apply for a financial incentive award, please visit oshpd.ca.gov/HPEF.